Hello and welcome to Dairy Council of California's 2025 Trends for Education and Health Professionals webinar. We're excited for you to join us today. I'm Renee Farias, and before we begin, I would like to share a few meeting reminders. This webinar will be recorded and shared with attendees afterward. So please keep yourself muted during the presentation to minimize background noise. There will be several engagement activities, and we appreciate your participation using the chat and poll features to join the conversation. And finally, we will have a brief question and answer session at the end of the presentation. So please jot down your questions and add them to the chat. We'll cover as many as we can. Today's presenters include Megan Holdaway, registered dietitian, nutrition science program manager, and co-author of the Trends publication. She is joined by Bessie O'Connor, registered dietitian and project manager at Dairy Council of California. And before we dive into today's discussion, I'd like to take a moment to share a little more about Dairy Council of California. We are a leading nutrition organization working in collaboration to elevate the health of children and communities through lifelong healthy eating patterns. We focus on education and advocacy, dairy egg literacy, and partnerships and collaboration. And now I will hand it over to Bessie.
Thank you, Renee. Thank you so much for that introduction. As you all know, you're here for our Trends presentation, and it is adapted from our recent Trends publication that launched in early February. You can find the full text at dairycouncilcalifornia.org/trends. Today, we'll review some highlights from that publication, but we also invite you to read the full issue at your convenience after the presentation. I'd like to take a moment to thank our collaborators. The Trends Advisory Committee provided feedback and insight on our draft publication, and acknowledgments go to partners that provided their perspectives and suggestions on the implications section of each trend. Our Trends program has been a part of our organizational success for 30 years, and our tracking process involves a team of staff who closely monitor publications, news media, and more. And then we meet throughout the year to discuss and distill down the findings from tracking those multiple resources. The trends capture developing or changing shifts in a broad range of areas, including dairy and the food environment, nutrition research, consumer behavior, and the school education environment, to name a few. And these provide a foundation for our internal strategic planning, but also we share key findings with partners like yourselves and provide implications that may inform or impact your work. So by the end of this training, you will have identified key trends impacting health and nutrition and examined the implication of emerging trends. Our goal today is not only to provide you with a deeper understanding of these topics that we'll discuss, but also to equip you with practical applications and empower you to navigate it more effectively. So we're going to start with a brief activity. It's called a chatterfall. If you haven't heard of it, this involves me asking you a question, and you're going to type your answer into the chat. The key, though, is to hold off on hitting enter to your response until I give you the cue. So the question is, why is it important to stay up to date with current trends? So I'm going to give you about 30 seconds to think about your answer and type it into the chat, but do not hit enter until I say. Okay, go ahead and hit enter now. Oh my gosh, it's a flood of just amazing, brilliant answers coming in. So let's see. So new health diet. Things are constantly changing, so we want to know what is happening as it happens. It's important to know what students want, and they go by what is trending. Very good. To be able to adapt to our changing environment, right? Being adaptable, being aware of the shifts helps us adapt quickly and stay relevant. So that's awesome. Drive innovation and participation. Yeah, knowing what people are interested in, is going to increase participation. Knowing the changing landscape. Kind of skipping around. This is how we best know how to serve the public. Staying up to date is important because we want to maintain optimal health and advocate for the health of others. To be familiar with research and trends. To please our students and family. Yeah, being able to relate to our audiences and build relationships. It's great. I'm going to scroll kind of to more, to be familiar with research and give the most accurate information. Yeah, this is great. So many good reasons to stay up to date with our current trends. So I'm so grateful that you're all here today and we can kind of learn from each other and dive into the trends. Next slide. So to set the stage for the trends, it's important to consider societal shifts. According to the 2020 U.S. Census, people of color represent 43% of the U.S. population, and more than half of young Californians identify as Latino. Also, we're seeing for the first time in history, the workforce includes 5 generations, the silent generation now 80 to 90 years, to teens and young adults from Gen Z beginning their first jobs. And if you don't believe it, my father is just retiring this year and he'll be turning 84. So there's definitely, just this wide range of, ages within the workforce. And these multi-generational workforces promote different perspectives and create multi-directional mentorship opportunities. So while we're seeing a broader range of ages in the workforce, women continue to be underrepresented in executive positions, and people of color continue to be underrepresented as educators and as healthcare providers. So in the midst of these demographic shifts, bringing diverse perspectives to the table will support finding equitable solutions to health and nutrition interventions.
Can you look with the decks on?
Yes, I was going to forward it to you. Yeah. She said that's
So
fine. She asked
with those demographic shifts in mind, the first trend that I'll discuss is the U.S. health gap grows. Despite advances in nutrition research and efforts to improve public health policies, adults and children in the United States are experiencing rising rates of chronic disease, mental health challenges, and age-related conditions like dementia and Alzheimer's disease. On the screen, you see the socio-ecological model often used in public health initiatives, which shows the multiple factors or the levels that impact health behaviors and outcomes. This highlights the very complex interactions between people and their environments. Individuals are often the focus of nutrition interventions, yet the conditions in which people are born, live, and work have a significant impact on health and well-being. But creating a healthy society requires, these policies and systems and environmental approaches to effectively shape and promote health. So how are we seeing the U.S. health gap grow? Chronic disease rates continue to rise across the population. Rising rates of chronic disease, including stroke, type 2 diabetes, and obesity, and then also severe obesity we see rising. Stroke rates, which can lead to long-term disability, increased by nearly 8% over the last decade. Similarly, diabetes cases rose by 19%. And then for both of these, the prevalence was greater for people of color, lower income, and older populations. We're seeing rates of severe obesity rise, particularly among women, and then childhood obesity rates continue to rise, with significant disparities between Black and Latino youth relative to white peers and youth who are socioeconomically disadvantaged. With this rise in childhood obesity, there is a growing interest and scientific evidence supporting the potential use of weight loss medications for children. However, experts are still recommending that children with high BMI first be referred for behavioral interventions. Health disparities extend beyond chronic conditions to outcomes such as maternal and infant health. Black women are nearly 3 times more likely to die from pregnancy-related complications than white women, and Black infants also face the highest mortality rates. Since 2012, 16% of all general acute care hospitals in California have stopped delivering babies, which may have an impact on these maternal and infant health outcomes. So to bridge health gaps and provide healthcare programs and policies that are effective, there needs to be trust in our regulatory institutions as well as in our health professionals. However, you can see on the graph that trust in American institutions continues to decline with rapid decreases in recent years. People worry that government leaders, business leaders, journalists are misleading, and only 36% of people express trust in the medical system. When it comes to trusted sources for information on healthy, sustainable foods, the top 2 are the Food and Drug Administration and the U.S. Department of Agriculture, but that trust is declining over time. And there's growing distrust of farmers and growers, as well as health professional organizations. However, a little bit of positive out of this is that their trust in registered dietitian nutritionists has remained steady. This mistrust may be in part caused by the unprecedented amount of health information and data that is available to patients and consumers through technology, online, social media, AI chatbots, some of which could be credible and some which are not always credible. On the slide, you can see that 68% of people trust content about food on social media, either a little or a lot, and 51% of people are interested in using AI to make food choices. Belief in misinformation and perceptions of science are highly influenced by education as well as trusted news sources, with most adults falling in the malleable middle, meaning they don't fully believe or disbelieve misinformation. So now we're going to take a minute to kind of reflect and do a poll question. What is one way you can take action to address the growing health gap? So we'll just give that a minute to launch. We'll give it a couple seconds to see. Looks like we're getting a variety of responses. All right, so it looks like the majority of people in the audience, one way that they can take action is to commit to sharing accurate nutrition education with the community to help combat misinformation, and also to connect children and families to nutrition education and access to nutritious foods through federal meal programs. So that's great.
You stop.
Megan, you can go ahead and share the results if you don't mind.
Can you see them?
Oh, yeah, I can. Perfect. Thank you. All right. So the implications of this trend are that really investing in and implementing policies that address social determinants of health and the root causes of chronic disease can improve health outcomes and equity. And looking at the impacts of nutrition insecurity and the causes of nutrition insecurity on health outcomes needs to be a part of the conversation. Also, health professionals play a very important role in connecting children and families to nutrition resources, including advocating for the benefits of school meal programs and other federal meal programs in supporting health. And registered dietitians are still highly trusted. And then lastly, health professionals and educators can help combat misinformation by sharing science-based nutrition education and help people identify credible sources for health information. All right, trend 2, culture and equity are prioritized in health interventions. So complex health problems need multifaceted solutions, and there are initiatives across the nation that aim to enhance health communication and education, including nutrition interventions that are incorporating culturally relevant foods and traditions. And then in the healthcare side, access to care and medical costs have a direct impact on health outcomes. And as people are less likely to receive preventative care and early diagnosis and treatment of illnesses and disease. In California, solutions to address health equity include legislation passed in 2024, which removes medical debt from consumer credit reports to give people more time to address their medical bills. So I mentioned that there are initiatives across the nation that are aiming to enhance health communication and education. And some examples of that are the University of Chicago NORC Center for Health Communication Science, which works with government and other charitable organizations to create culturally relevant communications that address health challenges for various audiences. In Arizona, the AZ Health Zone uses the language of health, which is a style guide that provides tools to encourage a comprehensive view of health versus simply labeling a food healthy or unhealthy. And then in California, Leah's Pantry promotes food security and healthy eating, particularly in underserved communities through programs that align with trauma-informed, resilience-focused principles. So those are just a few examples. There are many, many more. So thinking about the tech application and then how that's really being incorporated into the health and nutrition landscape, really considering these social determinants of health and, include behavioral science, geography, psychology principles, like some of the health initiatives that I mentioned on the previous slide have done with their nutrition education and health communication strategies. Really incorporating these strategies within technology-based strategies may make a really important contribution to individual health behaviors on a larger scale. And then looking at dairy innovation in related to the focus on culture and health equity, people are looking for health supporting products. And this is an opportunity for product innovation and education, especially taking into consideration that 30% of Latino, Black, Asian, and Pacific Islander populations report having lactose intolerance. So in the United States, consumers are drinking less milk, but they're turning to other dairy products such as butter, yogurt, and protein-rich options. Higher protein yogurts and milks are hitting the shelves to meet this consumer demand. And then cultured dairy products such as cottage cheese, kefir, and yogurt that have been linked to health benefits and versatile applications, as well as lower lactose levels, are also becoming more desired. And then lastly, lactose-free dairy products such as lactose-free milk and the role that they play in dietary patterns is also being recognized through the Dietary Guidelines of Americans scientific report. So what are the implications? Effective nutrition interventions need to consider how social factors, environmental influences, as well as individual behaviors interact to influence health outcomes. So empowering people with knowledge and resources allows them to make informed decisions about their health while also acknowledging that the definition of health is different for every person and really depends on a variety of factors, such as personal values, family background, as well as cultural influences. And engaging communities most affected by public health issues and involving professionals from these communities is crucial for really being able to identify those root causes and develop solutions to improve health outcomes. And lastly, there's an opportunity to educate people with lactose intolerance on the benefits of low lactose dairy products. Both lactose containing and lactose-free dairy products supply important nutrients that help fill nutrient gaps and can be tailored to meet cultural flavors and preferences. So with that, I will turn it over to my colleague Megan to take us into trend 3.
All right. Well, thank you, Bessie, for that great introduction to trends 1 and 2. I would going to dive right into trend number 3, which is women's healthy aging is in the spotlight. Women's health is a growing topic of interest to both health professionals and consumers. You may be noticing this yourself through various forms of media, such as podcasts, social media, traditional news outlets. And we know that nutrition from one life stage to another has an impact on health and quality of life. Promoting healthy behaviors such as nutrition and physical activity during adulthood is especially important as the population shifts to a growing aging population. How exactly is the population shifting? In California, the number of adults that are 55 and older will grow by 10% in the next 40 years, with older women outnumbering older men. And gender differences in the aging process become more apparent in midlife, which is around age 50, which really reinforces the need to address women's health and their unique needs throughout the lifespan. And looking more closely at women's health, there are several life stages that are crucial for optimizing nutrition and other healthy behaviors. I think we could go back. There we go. Starting with on the left with adolescence, this is a time of life where it's really important to begin to lay the foundation for future health by optimizing nutrient intake and developing good habits such as regular physical activity and adequate sleep. Unfortunately, we know that nutrient shortfalls often rise as healthy eating declines. They're no longer children and are beginning to make their own food choices, which doesn't always lead to adequate intake of important nutrients like calcium, iron, vitamin D, and folate. Next slide. Moving into pregnancy and the postnatal periods, nutrients such as calcium, vitamin D, iron, iodine, and choline really support fetal growth and development, but also the health of a woman. So ensuring adequate intake to support the needs of both mom and baby during that life stage are especially important. And then as women get older, they experience changes to metabolism and mobility over a period of decades. This, of course, means that those health supporting habits, again, physical activity, nutrition, sleep, can really help maintain bone health and muscle strength and health, cognition, and a diverse microbiome. Women, as they age, are at an increased risk for abdominal obesity, heart disease, gut dysbiosis, and depression, as well as the hormonal shifts that are experienced related to the menopause transition. So during middle age, the goal is really, maintaining health and mitigating decline as people move into older adulthood. One thing that's apparent from consumer data is that people of all ages are embracing positive aging behaviors. So from their 20s to their 80s, people are showing an interest in optimizing aging through food and beverage choices. And the top 3 criteria that they use to define healthy food are fresh, good source of protein, and low in sugar. And then some of the benefits that are sought from food include that healthy aging, weight loss and maintenance, and as well as digestive health. I also wanted to note that 71% of people report that they are trying to consume their protein from food. So really focusing on those food sources of protein. With this increased focus on protein combined with the nutritional benefits of dairy foods means that the market for high protein dairy products is expanding. And we know that dairy foods offer a unique package of nutrients that can help maintain bone strength and prevent muscle loss as women age. In fact, higher dairy intake is linked to lower levels of markers that are linked to impaired bone health, which indicates that regular dairy intake may support bone turnover and structure. Dairy foods also have those functional health benefits, which are the benefits of a food beyond the nutrients they contain. So this is specifically probiotics that are found in fermented dairy foods, such as yogurt, kefir, and some cheeses. So this, really can help support gut health at all life stages. But research on the microbiome is expanding. We keep learning more, and there's evidence that a quote unquote younger gut microbiome is linked to a lower risk of heart disease, regardless of a person's biological age. So a lot of exciting research coming out about the way that food can influence our health, our gut health, and our long-term wellness. So looking at the specific implications for this trend, first is that it's important to really consider bone and muscle health at an early age and to take steps to reduce the risk of problems later. So beginning, early life, but especially adolescence, moving into 20s and 30s, diet is a critical part of supporting bone and muscle growth and development, and then maintaining that as throughout life. Women can optimize their physical and mental health with high protein beverages and gut enhancing products, including yogurt and a few that I mentioned previously. And then finally, milk and dairy foods, again, have nutrients, including calcium, phosphorus, magnesium, zinc, protein, and these are affordable and accessible, making them an important option throughout the lifespan. So we have a quick poll question. Are you able to launch it? Oh, there we go. So the question is, how important do you think life stage interventions are in addressing women's health issues? All right, we've got about half of you have submitted your response. Give it a few more seconds. All right, let's go ahead and share it. So it looks like there's some overall consensus that it's very important. So that's, a good sign we're all here, because we know that how important it is to, have interventions throughout the lifespan for that long-term health for women and adolescents. So somewhat important was another option. So they play a role, but other factors are just as significant. So acknowledging that it's one factor, but that there are other factors as well. Thank you all for your participation. All right, and then diving into our final trend of the day, this is trend 4, an evolving food and nutrition policy landscape. As you can see from the variety of headlines that are posted here, regulatory changes are happening fast, and uncertainty around long-term funding is increasing. This evolving food and nutrition landscape is happening against the backdrop of soaring food prices and public concern about topics such as food additives and sustainability. Before we look at the current food and nutrition landscape, it's important to understand that according to the Dietary Guidelines for Americans, most Americans across all age groups have poor quality diets. They underconsume recommended food groups. Those are vegetables, fruits, whole grains, and dairy, and that ultimately experience nutrient shortfalls that are of public health concern, those being calcium, potassium, vitamin D, and fiber. At the same time, the issue of food and nutrition insecurity continues to burden families in the United States. This is reflected by the more than 18 million households who are currently struggling to put food on the table. Furthermore, rates are disproportionately higher for households with children, people living in rural communities, and Hispanic and African American populations. These issues contribute to those increased levels of obesity and chronic disease that we were talking about in Trend 1, and negatively impact the growth and development of children. Food insecurity is, again, linked to those poor health outcomes, which really heightens the need for solutions that will help close this gap. Recommendations to improve healthy eating serve as a catalyst to change public policy that may ultimately determine the food choices available to vulnerable populations through nutrition assistance programs. Briefly wanted to share some statistics that are specific to California. 1 in 8 people face hunger every year. And for children in California, the number is 1 in 6. In other words, 1.4 million children in California face hunger every year. And additionally, almost half, or 49.2% of households who receive SNAP benefits have children. The U.S. has a long history of initiatives to improve health. In recent history, beginning in 1969, the first White House Conference on Food, Nutrition, and Health led to the expansion of major food and nutrition programs, including the SNAP and WIC programs that we're probably familiar with. The Let's Move initiative in 2010 worked to combat childhood obesity, increase physical activity, and encourage healthier eating habits. And then just a few years ago in 2022, the second White House Conference on Hunger, Nutrition, and Health led to the release of a national strategy to end hunger, improve nutrition, and reduce diet-related chronic diseases and address disparities in health outcomes. Presently, we have the newly formed Make America Healthy Again Commission, which is currently only internal, and it is broader than nutrition, but will focus on identifying and reporting on best practices for preventing childhood health issues, including through proper nutrition and the promotion of healthy lifestyles, as well as evaluating the effectiveness of existing educational programs that relate to nutrition, physical activity, and mental health for children. These efforts have all had an impact on America's health, although, as we've noted, challenges remain, including persistent food insecurity and rising rates of chronic disease. So in addition to these initiatives and efforts at the federal level, we have the Dietary Guidelines for Americans. Every 5 years, the U.S. Department of Health and Human Services, or HHS, and the U.S. Department of Agriculture, the USDA, release the Dietary Guidelines for Americans. These are evidence-based recommendations on what and how much to drink for optimal health. They are general recommendations that are written for policymakers, health educators, nutrition program operators. And the scientific report of the 2025 committee was released this past December for consideration by the secretaries of the HHS and USDA as they develop the guidelines. The departments are not required to implement the recommendations in the guidelines. And despite uncertainty about the timing of the release of these recommendations with the change in administration, both departments did recently announce that the work of the 2025 to 2030 dietary guidelines will continue, that they're currently reviewing the scientific report, and that they anticipate a release prior to the December 31st deadline that is mandated. So just wanted to kind of talk about some of the high-level findings from this scientific report. First, they're related to diet quality and nutrient shortfalls. Continue to see underconsumption of food groups, as mentioned previously, including dairy and fortified soy alternatives. And then the same nutrients of concern remain, which are vitamin D, calcium, potassium, and fiber. So these are nutrients of concern for anyone aged 1 and older. There was also an increased focus on plant-based proteins in the diet. So these would be things such as beans, peas, and lentils. So those being some of those fiber-rich foods and how those can be incorporated in more diets. Recommendations on ultra-processed foods, which is a hot topic, were not made, but were passed on to future committees with the expectation that research related to this topic is really going to explode in the next 5 years, that we'll see a lot more come out on this topic in the next round of scientific reviews. And then dietary patterns. So currently there are 3 dietary patterns that are recommended in the dietary guidelines for Americans. This committee proposed one pattern called the Eat Healthy Your Way dietary pattern. So this is a single, inclusive, and flexible pattern that could be modified based on, preferences and cultural background. The proposed pattern promotes the consumption, again, of those vegetables, fruits, legumes, whole grains, and low-fat or fat-free dairy. So it does recommend decreasing intake of red and processed meats within the protein food group. In California, California has been a leader in school nutrition policy. In 2022, it became the first state in the country to offer universal school meals, which is free breakfast and lunch for all children in California schools, regardless of income. Under Governor Newsom, the state has also maintained a longstanding ban on soft drinks in K-12 schools and also imposed caffeine restrictions at all grade levels, while federal standards still currently allow caffeine in high schools, and then also proposed a sugar limit on alternative beverages, which is expected to take effect in 2025. And then also in September of last year, Governor Newsom signed into law AB 2316, which makes California the first state to ban several food dyes in school meals. This year, in January 2025, Governor Newsom issued an executive order to investigate the health impacts of synthetic food dyes and to expand access to affordable, nutritious foods. It also directed state agencies to reduce the harm of ultra-processed foods and risky food ingredients. Additionally, Assembly Member Gabriel recently introduced legislation to limit the sale of ultra-processed foods in California schools. And the details of the bill aren't clear, and we are on a 2-year cycle in the legislature, so it may be another year before language is added to this legislation. So as legislation and regulation related to ultra-processed foods is being worked out and studied and examined, it's important to understand that food processing alone does not determine the healthfulness of a food. There are many benefits to processing, including safety, affordability, ease of preparation, longer shelf life, and decisions should ensure that a safe, affordable, healthy food supply is available. Second, healthcare professionals, including registered dietitians, can stay informed and serve as experts, really providing that evidence-based nutrition information as patients and consumers are trying to seek information on food labeling or dietary guidance or any other regulatory updates, and could even potentially be a resource for policymakers who are seeking information on food and nutrition. And then finally, food and nutrition policy changes impact the school environment. Science-based nutrition education and culturally relevant school meals can continue to support students' health. And by providing them with credible nutrition information, as well as a variety of foods that meet their preferences and nutrient needs, we can really support children's health despite ongoing or in spite of any changes that happen. All right, well, thank you. And I'm going to pass it to Renee.
Thank you, Megan. And it's now the Q&A portion of the presentation. If you have any questions, please enter them into the chat so that we can ask our presenters. I will be asking them your questions. I don't see any as of now. I just see our Chatterfall activity.
we'll give it a minute to see if there's any questions that roll in. We could also advance to our survey so that as people are entering their questions, people that don't have questions can take the opportunity to provide feedback.
Sure. As you're thinking about your questions, we can introduce our survey. So we would appreciate your feedback on today's presentation. Please complete our survey by either scanning the QR code, or I will put a link in the chat so that you can easily click. Sorry, having a little bit of problems with that, but I will get that in the chat. We do have a question right here. With serious rolling back of DEI initiatives and noting that most of the nutrition problems impact minority communities the most, how do we move forward serving the people who need the info the most?
Bessie, did you want to take that question?
I'm going to reread it. With serious rolling back of DEI initiatives and noting that most of nutrition problems impact minority communities the most, how do we move forward serving the people who need the info the most? I think that there's, with the change of administration, there's been, some initial concern of rolling back DEI initiatives. But I think just being able to tap into the organizations that are able to provide resources and initiatives to support, programs and really build those partnerships and collaboration is going to be key to continuing to be able to reach other communities that are impacted most. Did you have anything to add, Megan?
No, I would just agree with that. Maintaining that focus and working together with, really building that collaboration to be, to continue to reach vulnerable populations.
Thank you. We now have the link to the survey in the chat.
I see another question. So the other question is, I noticed that a lot of programs are still implementing low-fat milk. Have you looked into how fat is beneficial for the brain, controlling inflammation, blood clotting, and even helping stay full longer? I thought to share this because this may be helpful for children especially.
Yeah, that's a great point. There is, research on the benefits of fat in milk and, continue to see the evolution of that in the dietary guidelines. It does continue to be recommended for adult populations, but knowing that full fat milk can, especially for young children, plays an important role in brain development and growth.
And there's, growing research, like as Megan mentioned, it's still recommended in the dietary guidelines for Americans to provide low fat after 2 years old. But there's, growing, like I'm sure that you're aware of due to the question, but just growing research that there's, not the association with overweight and obesity either. And so they're looking at all of these other functional health benefits that, the whole fat dairy matrix provides. So they're, hopefully we'll see more research to support the inclusion of varying fat levels in the diet as we, in the next round of dietary guidelines.
Thank you, Bessie. I'm not seeing any more questions, but we still have time to submit.
And maybe we'll give it another minute just to see if any other questions roll in as people are kind of considering all the information that we shared. Okay, well, we can advance to the last slide so that as people are exiting, they'll have access to our contact information, as well as the full report. So here, as we mentioned in the beginning, Dairy Council of California.org/trends is where you can access the full publication if you wanted to read more. There's more detail in the full publication. So this, you can either scan the QR code or go to this this link, and you'll find the full publication there, as well as the full citation list as well. And then our contact information is here. So feel free, as questions come up, if you want to reach out, we'd be happy to further this conversation.
And thank you once again for joining us. We hope everyone has a great day.
Thank you.